A seizure is any change in awareness, behavior, or sensation due to abnormal electrical activity in the brain. First of all, I want to make sure that you are calm. If you are aware that the seizure is starting and the person is still standing or even sitting, it would be helpful to try to lower them to the ground. And then you want to remove any objects that could fall onto that person to avoid them hurting themselves. If possible, timing the seizure can be very helpful. The majority of seizures that we come across really only last about 2 to 3 minutes. After the seizure is over, when the twitching or the stiffness is over, it is very helpful to put the person onto their side, as that is a little easier for them to breathe, and if they do have to throw up, they won't choke on that. You do not want to sit on them or hold them down when they are seizing. You do not want to put anything into their mouth when they are seizing. The risk of putting something into their mouth is that they can either bite your finger off or you break their teeth by whatever object you try to put in there. If it is the first seizure for a person, then definitely it is reasonable to call 911 and have them evaluated in the emergency room. If it is a person who has a history of seizures, then it really depends on whether the seizure was their typical seizure and the seizure stops on its own and the person wakes up again. That would not require an emergency room visit. Unless someone feels uncomfortable, then it's always reasonable to call 911 and have that person evaluated. In the most cases, unfortunately, we don't know why anyone has a seizure. This electrical activity is really just a sign that something is irritating the surface of the brain where we have the neurons sitting, and we always look for structural abnormalities, but we know that metabolic causes as well as genetic causes can cause seizures, and if we have 2 seizures that are unprovoked, then we call that epilepsy.